Do you or someone you know take Ramipril for blood pressure or after a heart attack? In this video, I'll explain what Ramipril does, when to use 2.5 mg versus 5 mg, common and serious side effects, what to watch for in pregnancy and breastfeeding, and the exact safety checks doctors do, all in simple language. Stay with me. Hi, I'm Abdul from Safe Dose. I make clear, reliable medicine videos. This is educational, not medical advice. Always consult your doctor or pharmacist before changing medicines. What is Ramipril? Ramipril is an ACE inhibitor. That means it blocks an enzyme that tightens blood vessels. By relaxing blood vessels, it lowers blood pressure, reduces strain on the heart, and helps improve survival after a heart attack or in heart failure. Main uses/indications of Ramipril: treatment of high blood pressure hypertension, heart failure management and reducing symptoms, reduce risk of heart attack, stroke, and death after heart attack in some patients. How Ramipril works. Ramipril is a prodrug turned into ramipril, the active form, which inhibits angiotensin-converting enzyme. This reduces angiotensin II and increases vasodilation. Dosages of Ramipril 2.5 mg and 5 mg. Typical starting regimen for adults. Often start 2.5 mg once daily, sometimes 1.25 mg in high-risk patients, and increase to 5 mg once daily after about a week, then adjust to the tolerated maintenance dose, commonly up to 10 mg total daily. Some regimens start 2.5 mg, 5 mg, maintenance 10 mg if needed. Always follow doctor instructions. Elderly or patients with low blood pressure or dehydration. Start lower and monitor closely. For hypertension, the usual maintenance is often 2.5 to 10 mg daily, single dose or divided, depending on response. Common side effects of Ramipril 2.5 mg and 5 mg. Most people tolerate Ramipril well, but common side effects include dry cough. ACE inhibitors commonly cause a persistent dry cough in some patients. Dizziness or lightheadedness, especially when standing up quickly or after first doses. Fatigue, headache. High potassium, hyperkalemia, in some patients, especially if combined with other drugs that raise potassium. Most of these are mild, but report them to your doctor. Serious but rare side effects. Serious reactions include angioedema, swelling of the face, lips, tongue, or throat. This can be life-threatening. Stop drug and seek emergency care. Severely low blood pressure, hypotension, causing fainting. Kidney function changes, can cause worsening kidney function in some patients, especially those with renal artery stenosis. If you experience swelling, breathing difficulty, very low urine output, severe dizziness, or fainting, seek urgent help. Contraindications and precautions of Ramipril 2.5 mg and 5 mg. Do not take Ramipril if you are pregnant or planning pregnancy. ACE inhibitors are contraindicated in pregnancy. If pregnancy is discovered, stop Ramipril and contact your doctor immediately. Have a history of angioedema related to ACE inhibitors. Have bilateral renal artery stenosis or are on certain combinations that raise risk of kidney failure. Also be cautious if you are taking potassium supplements or potassium-sparing diuretic. Can we use Ramipril 2.5 mg and 5 mg in pregnancy and breastfeeding? ACE inhibitors including Ramipril are contraindicated in pregnancy because they can cause fetal kidney damage, low amniotic fluid, oligohydramnios, skull defects and other serious outcomes, particularly in the second and third trimesters. If pregnancy is known or suspected, Ramipril should be stopped and replaced by a safer antihypertensive under medical supervision. Breastfeeding. Data are limited. Some sources recommend prefer alternatives * while nursing, especially for newborns or preterm infants. Small amounts may be excreted in milk, where possible prescribers choose drugs with better established breastfeeding safety. Discuss options with the doctor. Patient counseling practical tips. Take at the same time each day. First dose can cause dizziness. Stand up slowly. If you get lightheaded, sit or lie down. Keep hydrated but avoid sudden large fluid losses, vomiting, diarrhea, without medical advice. If you develop a persistent cough, tell your doctor. They may switch you to an angiotensin receptor blocker. Always tell any healthcare provider that you take Ramipril, especially before surgery, contrast dye studies, or starting new medicines. When to seek emergency care. Immediate emergency care if you have swelling of face or throat, difficulty breathing, fainting, very low urine output, or severe dizziness.